Hello, I'm Mark, and this is Average Guy Retirement. I'm doing this video because it may help some people that are experiencing lower back pain find a way to get rid of this pain on their own without going to doctors and without going to a chiropractor. Now, I've got to say up front, I'm not a doctor and I'm not a chiropractor, but what I am is somebody that ever since I was in my 20s has had to deal with a slip disc and going to chiropractors and even at one point I went to a bone specialist to even get that shot injection because I'd been to a chiropractor 3 times and couldn't get it fixed. So I went there, got a shot in my back, and it worked for a day, but the pain came back. And basically what that pain is just a pinched nerve. And usually what it is, it's always associated with, because I'm a pretty active guy, I may have jumped around somewhere and everything and, kind of slipped my disc again, and it gets on a pin and it pinches a nerve. And this is fairly common for a lot of people. But most people are afraid to go to chiropractors and doctors don't usually, they'll cost you a ton of money to maybe do something that might work or not. And I'm not saying don't try that in some cases, but to me, this is a safe thing to do on your own and to try before you go to the next level of, say, going to a chiropractor or going to a specialist doctor. Ever since I was in my 20s, and this happened when I was playing softball, league softball, I was sliding into base, went in on that side, and it must have slipped that disc. So I went to a chiropractor, and he put me on his table, did this little runny thing up the back. I don't know if it does anything or not, but it was one of these compression tables, and he would sit there and he'd flop my legs over when I was face down, and he'd say, okay, your one leg's an inch longer than the other. Well, so what he'd do is he'd get it and he'd start pushing and doing some things on that deal, but he'd always work that hip, down and everything. And he usually was able to fix this issue a lot of times. It really got fixed most of the time when I went to a chiropractor. Years later, I had the same issue, and it's usually one of these deals where the pain starts coming in slowly because you're slowly putting pressure on that nerve. And it may just be that you're barely pressuring that nerve. Sometimes it may come in harder. But sometimes it just starts, when you're sitting down, you start noticing it, and then all of a sudden, next thing you know, it's aggravating, and next thing you know, and it just doesn't go away. So I went to the chiropractor one time, and this was a new chiropractor because I hadn't been had to go, but like every 2 or 3 years at most. Sometimes I'd go 5 years without this issue, but sometimes it was, 2, and it felt like it was going every 2 years or so. So, I tried to find one of my old chiropractors and he wasn't around, so I went to a new chiropractor. And he really felt like he was doing a good job trying to manipulate my body to get it fixed, but it wasn't fixing the issue. So that's when I went to the bone specialist, and this is somebody I trusted because they'd already done a meniscus surgery on my knee and did a fantastic job. So I went there and they said, okay, we'll give you a shot in the back. I thought, okay, 6 months, I'll be able to, have no issues. Lasted 1 day. So I was frantic because, I'm a self-employed guy. I had to work at the time and still do up until for another month. But I needed to work and it was getting so bad that I couldn't hardly sleep. I couldn't hardly find a way to rest, and because it went on for almost 2 weeks, pressuring this nerve, and it was just getting worse. So what I did was get on YouTube, and I started looking for solutions that I could get on my own. And I came across a video years ago, and I can't remember, I wished I knew who had done this video, and it's been a while since I've seen it, and I couldn't find it again. But he showed a trick on how to get this disc to go back into place without going to the chiropractor. And I'm going to show it to you here in a minute. Now, I don't happen to, at this moment, to have one of my stands so I can stand the camera up over here and have a better down view, but I'm going to move this camera over and so you can see the whole area, this is where I do it. It's just on my sofa. And I'm going to show you the trick to which I do it. Now, the first time I show you, I'm going to show you what I did to learn to do it on my own. And it worked. It worked, you know, starting out just fine. But there had come a time when it didn't. It seemed like that it didn't work. And I found a way to adjust it to make it work. So I'm going to show you right now. Now I'll get this camera reset. So what I'm doing is I'm getting over here on my side. And this is the side that has the hip problem. Now, if it's the other side, you can do it the opposite way. But I'm basically laying on my side. And I'm going to put this leg, you know, pretty much over this leg. Now, what you'll do is you'll sit here, and I hold my hip back here, and I'm always pushing down on it. And what I'm doing is I'm going to be kicking like this. But when I'm kicking like this, I'm not trying to feel like I'm just kicking my leg. I'm going to feel like I'm trying to pull that hip with it. So you'll really let that weight go like that and push on it at the same time. And you may have to do this 20, 25 times. And it wouldn't hurt to just do it that way anyway. But when that doesn't work, and it's usually because you're just struggling to get that feel of letting that hip move instead of just feeling like you're, you know, working your leg instead of working your whole hip. So you have to push, and you have to really have that feel of that you're letting that leg pull out on you. There's that little feel there. Now, a trick I found to help do that is a boot. So what I would start to learn to do is I'd just get the heaviest boot that I've got, which is one of my hunting boots. And I'd put it on. There we go. Put this boot on. Now, obviously what this does is add a lot of weight to my foot area and this leg. So I get down in my same position here on my side with my leg hanging over kind of like this. And I just kick. And I'm trying to feel like I'm really letting that hip come with it. And you'll do this, you'll push on that hip, and you'll let that hip fall, and you'll keep doing this for 20 times or more. The pain doesn't just go away right then. It's not one of these deals where you just all of a sudden you hear a pop and no pain. It doesn't work that way. Usually what happened, and this is what happened every time with my chiropractor, is I'd get it, they'd work it, I'd go home, and usually within a few hours it would be more dull, the pain. And it took 2 to 3 days for it to work out. You know, because you're pinching a nerve, you're aggravating that nerve, it needs some time to decompress. So it usually took, you know, so if you started noticing by the next day that you weren't seeing, you know, some kind of drawdown in the pain level, you know, you can figure it started out, it was aggravating you up to 8 or 9, you know, if it's coming down to 4 or 5, then you know that you're going in the right direction. If it doesn't, I'd get back over and do it again. Now, sometimes with the chiropractor, I'd go to the chiropractor and I could tell that it hadn't started, you know, leveling down a little bit, and I'd go back, you know, because you could go back, especially if I did it early in the day and then I had to go back in the end of the day, you know, when I was at work, this would be going on, and get a second adjustment just because it was in, you know, price for the day. You could go, you know, a couple of times. But what I'm saying is that usually by the next day, you're going to notice some kind of level. You're not going to have no pain, but you're going to see a level of drop in the pain. And then usually within 2 to 3 days, you kind of feel like you're back to normal. So I'm basically doing this video in case you're somebody you think that can benefit from this. I have been able to benefit from this on numerous occasions over the past 8 to 10 years when I've learned how to do this. So, and it's worked for me. And there's even been times when I'll go to the chiropractor, like I said, and they won't fix it. I even had my last time I went to the chiropractor was for a pain in my knee on this side that kept getting worse, and it, you know, I'd have to, if I didn't get on it and everything, it would kind of go away, but as soon as I started using it again, it would hurt, and I couldn't figure it out, and it went on for days and days and days, and that's what happens when something's out of place and it's pinching a nerve and you're aggravating it based on what you're doing. Well, I went to the chiropractor and I told him, I said, look, the pain's right here. So, he tried to do stuff with my leg. He never fixed it. And I was out in my garage working on something. And I was even, trying to keep my weight off of it because it was hurting just to stand. And I had a little shop stool, that came up pretty tall and had 4 legs on it. And I went to walk to go do something on the other side of the shop, and I accidentally dragged the inside of my foot and hit one of the legs on that chair. And I felt this instant pop, like a pop. And all of a sudden the pain was completely gone then. I mean, completely gone. It was weird. I mean, this is one of those times when there wasn't no 3-day healing process. This thing instantly stopped having pain. So, sure, chiropractors aren't always going to be able to figure it out. And in some cases, you might be able to by learning, little tricks, that if you know your body, sometimes you'll know. If I ever get this leg jammed up again like that or whatever, I'm just going to try to do what I did before, accidentally knock it back in place. But these are things I've learned over, decades of having some issues. But right now, I feel great. And a lot of people would probably still be suffering with pain they don't have to put up with if they were just, try to learn some of these tricks on their own. You can go on the internet, go on YouTube, and, kind of say what you're feeling, what the problem is, and maybe learn a way to get rid of it. A lot of them are doing stretching exercise and all that, and that's fine, but I want an instant pop, fix in a lot of cases. And this is one that worked for me when I slip a disc here. Now I've had it happen on both sides, and I'll, fix it both ways. I'll just turn to the other side and kick. So, and I haven't had the issue with my knee again. And if I do, I'm going to do it the same way. I'm just going to accidentally pop it. As a disclaimer, I'm not a doctor, so I don't want you to do something that's going to terribly hurt yourself. And, some people just have degraded discs and everything, and they can't do anything about it. But for those of you that, pop it and go to the, chiropractor every time, you can try this on your own. And like I said, it can't hurt to just do a little kicking, and see if you can't fix it that way before you go to the next level. Good luck with it.